Hi there. We love doing live webinars where we can share best practices and topics of interest to you. To learn more and to access the resources referenced in this video, please scroll down to the video description. Without further ado, I'll turn you over to the team.
I have popped my webcam on, and I believe if I stop sharing the screen here, that I will, we should just be able to see you and me. And let me ask Jeremy, who's our events coordinator, to confirm that. So Jed, are you able to see? You can just answer me on Slack. Are you able to just see me and Carl on the webinar at this point? Okay, perfect. All right, so that is great. And so Carl, thank you so much. I'm gonna just do a little rearranging on my screen so I can see you a little bit better, and we can move on with this conversation. Fantastic. All right. Okay, so basically, I mean, Carl, I think, you know, as we said, we're just going to handle this as a candid conversation between you and me today. And you know, to get started, I just have, and first of all, we have a good audience online. We expect more people to join, and then this will also go out on YouTube. And so a lot of people will be able to enjoy it and appreciate it that way as well. You know, having said that, what I wanted to do just to get us started was to, you know, really get to know you a little bit better. So we have mostly a home care audience today. And you know a real lot about home care, and could you just kind of give us a little bit of your history with the home care industry and that kind of thing as a starter?
Sure. Thank you very much for having me first and foremost, and sorry about the delay. I was just trying to get myself settled in here.
No problem.
Miscalculated timing a little bit, but we are here, and sorry about that delay. To give you a little background about myself, I think it's best to start with the story of my parents. Both my parents are immigrants from Haiti. Both healthcare professionals, came to the States and tried to drill down healthcare into all their children. They wanted us all to be physicians. I decided that wasn't the route for me. However, in 1996, my mother founded a nurse staffing firm. She thought it would be a good idea to provide nursing registry services because she worked in a nursing agency, and she felt that she can run one herself, but she never had the computer skills. And that's where I kind of started my journey in this. So I was 14 years old, functioning as her assistant, doing everything from onboarding of staff, placement of staff, managing QuickBooks, doing our invoicing, that sort of thing. And in that time, she also got the idea to launch a home healthcare agency. So from about 1996 to 2001, we were in the application process in New York because we're generating our policy and procedures from scratch, which I do not recommend anybody do. I highly recommend everybody work with consultants for that, because we would draft these policy and procedures using, word processor and submit them to the state. The state would come back with whatever their rejections were, whatever needs to be updated. You'd attempt to update that again, push it back to the state, wait a few months to hear a response. Different error, but that was the process. But from 2001, when we got licensed, to 2010, we still functioned entirely as a nursing registry. It wasn't until 2010 that we started to get solicitations on our license. It was an inactive license, and New York had placed a moratorium on issuing new licenses. So the call started at 50,000 to 100,000 to 200,000 to 400,000 for this license.
Wow.
And we discussed it and said, well, we have something here. If people are willing to buy this license for $400,000, maybe we should start looking at this business a little more seriously. It was just not a license sitting on our shelves. So from 2010 to present, we have been a home healthcare provider in New York, focusing entirely on a managed long-term care patient census. So these are all Medicaid patients who have a chronic long-term need. And we, as of 2019, provided a little over 500,000 hours in services, totaling about $12 million in revenue. This year, I launched a new venture, which is called AidBook. This is a skilled home healthcare agency and non-skilled in both New York and Florida. what I wanted to do differently with this company was that I wanted to have technology at its core. So we are very much a tech-enabled home healthcare service, looking to rapidly scale and potentially be one of the leaders in the industry in the next few years, I would say.
Yeah, fantastic, Carl. Well, thanks for that background. Yeah, it's great. So 14 years old, and you're here from, when did you immigrate, just out of curiosity?
No, I was born here. My
Oh, you were
parents.
born here, so your parents, yeah. And do you speak like French Creole and that kind of
Yeah,
thing?
French Creole. I also picked up Portuguese, learning Italian now. But the
Wow.
native language in the household would be English, honestly, because I'm the third child. So by the time that came around, they were pretty comfortable speaking English. But
Yeah.
it was English and Creole to speak to the grandparents, that sort of thing.
Yeah, fantastic. Well, hey, we kind of started a little bit abruptly here. I just want to make a couple general announcements. So first of all, we in Ankota, we have a new team member who joined us just a couple months ago. Her name is Malavika. And actually, Malavika, as part of her learning, she did what we all do. She went to YouTube and she started trying to learn about home care. And she actually came across some of Carl's videos and said, hey, this guy really, I mean, first of all, great guy, charismatic, and really, and it was actually Malavika's idea to reach out to you and to bring you on today. And interestingly, another thing that you reminded me of is that it is difficult to register a home care agency in different states, and the rules are different. And one of Malavika's marketing projects, she actually created a site on Ankota's website which covers all 50 states, and it talks about, okay, well, here's how to register in the state, here's where the who the state associations are and various things like that. So great work there. And it is it is very, very tricky to figure that out. But I guess a very important thing here is that, as you could tell, as you're on as participants today, we're kicking off a conversation. I had a few people said, hey, like, I signed up for the webinar, I can't come, but I'd love to ask Carl this question. So I have a few questions to get us started. But in your GoToWebinar console here, there's a place where you could put questions in. And as you put them in, we'll see them. And then when we, I have a couple of my own, but once we get past there, we'll be, using your questions and sharing them with Carl. So I guess the next thing I have, Carl, is that your site and your YouTube channel, it's called ENTPlife. And I think a lot of people guess, oh, that must mean entrepreneur or something, but I don't think that's what it means. Could you explain to everybody what an ENTP is and kind of how that makes you special?
Yeah, so what an ENTP is one of the 16 Myers-Briggs personality types. And I took a personality test, or at least I was paying attention to this personality test for the first time a few years back, because someone had asked me what is my Myers-Briggs personality type. I was like, I had no idea. So I took the exam, and I registered as an ENTP, assertive type. And it really blew my mind how accurate the profile was for me. ENTPs are extroverted, intuitive thinkers. And essentially, it's just a framework of how we approach information and approach life. So we like to interact with people. We like to interact with the outside world. We like to project our thoughts. We also have a way of being keen innovators and problem solvers, and also kind of jacks of all trades. So new things are always taking our interest, and we're able to process through information relatively quickly, especially compared to other personality types. The downside to that is that we're highly distracted, and we often start projects that we never end. And this tends to be something that's synonymous with a lot of entrepreneurs as well. But people confuse the fact that I'm an entrepreneur, and I heavily talk about my ventures in real estate and in home care and some of my other businesses. But one thing that I wanted to do was talk to other ENTPs and provide them with a framework that I think can work for them, so that they're not so scattered and they don't feel like they're falling into this pattern of starting and stopping and essentially just being a problematic person, because that's what I thought I was. I thought I had these bad habits that should have been addressed as I was a child. And it turns out that it's just how I'm designed. And I thrive best in project-based work, more so than routine work. So I try to encourage everybody to understand and learn what their personality type is, understand its strengths and weaknesses, and build teams around those strengths and weaknesses. And that's what I try to teach the most on the channel.
Wow, that's fantastic. And yeah, and you actually jumped a little bit into my next question. So you do have ventures in real estate, you know, house flipping, different investments, and you help a lot of people in a lot of different ways. So how do all those pieces tie together? And tell us a little bit more about, you know, what's kind of your core message and how you try to help people.
It's kind of hard to say how it ties all together. I think it ties all together in me. I need to be engaged. If I'm doing the same thing over and over again, I can't do it. I even had another channel that was based on cooking, and the fact that I was just cooking every episode frustrated me. I can't just do the same thing over and over again. So the channel is more just an expression of myself and what I'm doing. But what I want to do is that I know as an ENTP, I've done so many things and I have a lot of knowledge in so many areas. And I always notice that other people who are getting into new businesses or relocating or whatever it is, whatever sort of change was going on in their life, they didn't know how to quite deal with it, or they didn't know the steps. So I always would find myself explaining how I went about starting my flipping business, how I invest in real estate, how I started my home care agency. And I wanted to be able to give guidance to people who are just trying to get over that initial, how do I get started hump? And that's what we try to concentrate the most on. So really what I want people to take away is that, you know, whatever you can dream, you can actually bring into reality. You know, we see it all the time: bridges, airplanes, Wi-Fi, internet. These are the brainchild of human beings, right? These are the things that we once dreamt of, and then somehow we as a group of people built it and made it real and improved everyone's life. So that's what I try to stress to people, is that, hey, there's a pathway to everything. Here's how I did it. Here's what I know. So either replicate or improvise as you see fit.
Yeah, fantastic. Hey, just jumping back for a second. So I know could you confirm for me? I'll put this in the notes of the YouTube video and things like that. So if people want to assess what their personality is the site, I think it's 16 personalities. Is that?
Yeah, that's a short form. Yeah, that's what I recommend people go to first. It's 16personalities.com. They give you like a short form Myers-Briggs test. You can do it in like 15 minutes, and then it spits out what your results are and a long, I don't know, maybe 7-page blip about the different things: overview, strengths and weaknesses, how you are in relationships, how you are as parents, how you are in the workplace. And then you can also research and look at what the other personality types are. So I tell people to kind of like do themselves, do their partner, do their parents, right? So they could see how their personalities kind of match or clash. And you'll start to see that the people that are your friends tend to also be personality types that your personality type naturally kind of gravitates towards. And even if they're like, for instance, INFJs are like the yin and yang for ENTPs, right? They're like 1% of the population, and ENTPs are about 3%. But I have a lot of INFJ friends. Why? It's because for whatever reason, we think in very different ways, but in very similar ways. And we kind of contrast each other. And when we do come across each other, we end up befriending ourselves. I would say INFJs and ENFPs are probably the people that I connect with the most, and other ENTPs, as far as like friendships are concerned. But when you do the test, you'll see a complete profile of yourself. But I do encourage that you do it with others to kind of start to learn about how your personality interacts with others, and it starts to make a whole lot more sense.
Yeah, fantastic. All right, so there's questions flowing in from the audience now, and so I think we're shifting the conversation a little bit more toward kind of hacks for home care, if you will. And so it's kind of interesting when we speak to agencies. I'd say our bigger agencies that we work with, their biggest issue is kind of attracting and retaining the best caregivers. And interestingly, our smaller agencies, the biggest issue that they run into is kind of getting that first base of clientele. And there's actually a couple questions around those. But this first question I wanted to pass to you is, it says, what are some ideas or hacks or things that you've done to kind of make the caregivers feel like they're part of a bigger team? in home care, because some of the feedback from caregivers is that, they don't really feel connected to the bigger agency, and sometimes they feel like they're in a communication void. So is that anything you have some ideas on?
Plenty, because it's something that's really important to us. One of our core values here at AidBook is teamwork and making sure that people feel inclusive. So from the very first interaction, we try to treat every person who's going to be employed by our company as a member of our team. When it comes time to onboarding during our in-services, it's something that we repeat again. We ensure that everybody understands teamwork is part of our core values, and we have an open door policy regardless of level within the company. Any employee in our company has the potential to shift the company's direction. So we want our employees to be empowered and to kind of function as entrepreneurs within the company, identifying problems with services, identifying problems in the patient's home, and bringing that back to us so that we can fine tune either our technology or fine tune how we're delivering services. And by kind of involving them in that way and saying, hey, even as a caregiver, as a personal caregiver, home health aide, CNA, whatever you're classified are, as a lot of people tend to look at the education level and minimize that employee group, but they have the most value to offer the agency because they're there with the patients the longest. They get to see exactly how patients become non-compliant, what issues are they facing with the family members, neighborhood, etc. So we have them come back to the company during in-service, during any opportunity that we have, during our QA, QI, or our QAPI meetings, to voice what their experience is like and to even provide us with some solutions that they think can improve how we work as a company. So by having this open dialogue and having them be able to shape how we function as a company, ultimately lets them know that they are part of our team and that they have a voice and they're just not a number on a list.
Yeah, that's really, really fantastic. You might have seen me scribbling. I think that's really, really powerful that any caregiver in the company can change the direction of the company, with a great idea. So I think that is very empowering, and I loved everything you talked about with the in-services and how you do that. It's kind of funny. I teach a couple of university classes, mostly in information technology. I'm a geek, and one of the quotes that I share is that Jeff Bezos from Amazon.com is that anybody in the company could win an argument against a more senior person if they bring the data. And that kind of thing. So it's a little bit of a silly analogy, but I think that it's a really empowering message to your caregivers and your team, and that's fantastic. Another one that came in here is that and we've kind of seen this. I'm putting some context around it, but sometimes we see an agency and they're getting off the ground and they get up to a certain size and they're like, hey, we've hit our 25 clients, we've hit $1 million in revenue, we've hit 30, and then they kind of stagnate. And then every once in a while, for lack of a better term, I'm going to call it a bad Monday, right? So what'll happen is, like just from some seasonality, some people have moved, back to a different location. So you lost kind of 2 clients that day. And, and sadly, the people we care for don't stay with us forever. So, like maybe 2 clients passed and, and 2, kind of moved to another geography, and all of a sudden, so you just went from 30 clients to like 26, and, you were just like there and you're kind of over that hump. And, and I guess, like, first of all, it sounds like you really have a strong, growth focus. And do you have any ideas that you could share with, how do you avoid those bad Mondays when that happens now and again? And, and just kind of some thoughts on always, having the growth engine going and not just kind of plateauing, or, any thoughts there?
Yeah, that's wow, that's a pretty wide question. So what I've noticed is that a lot of smaller operators, they think small. And because they're thinking small, they're looking at their profit margin being the spread or the margin between their cost and their earnings, right? And by definition it is. So they look at expenses in a very different way, and they're always trying to cut back on expenses rather than spend their way towards success. And because of that, when they get to that 30 patient mark or 25 patients, they're, like you said, that's about $1 million rev. Patients are averaging around 40 hours or so. They think that they've made it, and they start looking at how to spend their profits. They get a bigger house, nicer car. They need to show to the public that they are successful in their business, rather than reinvesting in more marketing, right? And people that can actually grow their business further. Usually from 0 to 25, you're your own marketer, and you're going out there, you're talking to people in your community, social workers, case managers, whoever it is that you're sourcing your clients from. And you never had someone who's in that role. And now you're busy enough that you're functioning as part-time marketer, part-time, you're the administrator most likely, you're handling HR responsibilities, you're handling all these responsibilities, and then you keep raising your pay because you finally want to feel like you've made it. And I think that's the mistake that they fall into. And then they lose those 4 patients or 3 patients on a bad Monday, and now they're even less likely to spend. So my recommendation for people who are just getting started, don't think of any of the early money as your money. All of the early money is the business's money, and every penny should be spent on growing your business, and that's through attracting the best talent you could get and the best marketing spend and the best advertising spend that you can do. A lot of, just like you said, data is what drives everything that we do in our company. We look at the lifetime value of an aide. How much is a home health aide going to bring in revenue on average? How much time did he stay with the company? How much do we earn on that home health aide when they are working in the average capacity? We look at the lifetime value of a patient. How long does a patient stay with us if they have a certain payer type? If that's managed long-term care, it's usually for life as long as we provide a good service. So how much are we willing to pay to either attract the home health aide or attract a new client? And we look at everything from that perspective, and we consistently adjust our spend according to what the outcome is. So my overall advice to avoiding that initial downturn is use all the data that you've collected. What works for you to get clients, and really think about how you can multiply yourself by hiring a marketing representative that will do exactly what you do or better, because they should only have the time to do that, and quantify how much is that worth to you, right? So if 10 patients a month is the target that you think that they could hit, and you're paying them $8,000 a month, well, I know that in the New York market, a patient is worth about $10,000 to $15,000 lifetime value. So if that person's creating $100,000 of value and you're paying them close to $10,000 a month, that should be a no-brainer spend. A lot of people will look at that spend and say, well, I'd rather have that $8,000 to $10,000 in income so that I can improve my lifestyle. This is why I started this business. So that's a long-winded answer, but that's truly what I've seen to be the pattern of what separates the companies that scale and that don't. Especially a lot of operators are usually nurses. They may not have really strong backgrounds in business, probably never took a business class in their life, they've always been focused on sciences and the actual care administration. So they've never built the mechanics of building a company. And because of that, they tend to have that small business mindset. And I think that's what really limits the growth there.
Right. This next question, I'm just chuckling as I read it. So this one says, like many home care agencies, we have a website that has stock photos and basically says that we provide the standard home care services, but we're not really finding that our website is doing a lot for us. And we see that you have tens of thousands of followers on your social media. So like, what would you recommend for us to take our website and our online presence to the next level?
Perfect question. I actually like that one. It doesn't matter if you have stock. First of all, it doesn't matter how your website really looks, because people only know of your website if they know of it, right? That's like back in 1996, having a website was a big deal. Now it's kind of a standard thing. The difficulty is driving people to that website and making them aware of the service that you provide. So you could do that one of two ways, either by organic discovery, which is going to be SEO, content creation, that sort of thing, or by paying for ads. Ads are expensive, especially now, they get more and more expensive. So the stock photo doesn't really matter. The design makes a difference somewhat, but a lot of sites are kind of crappy anyway, in my opinion. So what really matters is you get people's eyes, right? You need people to be aware of who you are. And then that's your opportunity to upsell them. So, or to sell them in general. So one of the ways that we get traffic to our site is through social media. Social media, to create content, is free. Okay, you could create blogs on information that you know on your experience as a company. And when you're creating a blog or you're creating any kind of content, you want to make sure that the content that you're creating is addressing either a core need that people have or a critical question that people have. One of my most viewed videos on my channel, ENTPlife, is how to start a home care agency. I created that series because I was in the process of starting my home care agency here in Fort Lauderdale. And I was like, you know what? I'm sure people are curious. And it's like, I'll just start documenting it, right? Just documenting my life. And I phrased it, how to start a home care agency, because that's what people would typically search if they're going into Google. How can I start a home care agency? And that's how most people find me. So you want to make sure that you're creating content around highly searched ideas or concepts. How to find a visiting nurse, how to find a home care nurse, how to find a home care agency, how to pay for a home care agency, what payers exist, free home care, how to get it, whatever would come to your mind as like commonly searched phrases and terms that the general public may use to around the home healthcare industry. You should be creating content around that, so that when people are searching and using Google, using YouTube, or even if they're discovering you through Facebook, Facebook is also going to kind of track your search behavior, and it's going to offer you up what you've already been looking into, right? So you want to make sure that you're kind of presenting or creating content that addresses people's questions and that's drafted in a way that answers what they're looking for, right? And then when you do that, you start to get that organic, natural information, and then you start to position yourself as an expert in that area. So you can do that with blogs, you can do that with YouTube. Another company that does this really well, and I highly recommend that you check them out, is a company called SlideBean. SlideBean creates like pitch decks for startups, and it's pretty much like PowerPoint but cooler in a way. SlideBean has a YouTube channel, and on their YouTube channel, they talk about all things startup related, growth cycles, startups that failed, like why did Nokia fail? Why did Research in Motion or RIM or BlackBerry, why did they fail? What did these giants do that either propelled them like Airbnb or killed them like Nokia? And everything's around like tech ideas. But in every single video that they put out, they talk about SlideBean and why it's great and how exactly. So, and they've been able to grow their subscriber base based on providing good content that's interesting, engaging for people that may have the same interest in starting a company or maybe a startup founder. So you want to kind of create content around that. Like one video that I'm thinking about doing is how to care for someone who's recently had a stroke, right? In that article or in that video, there's so much to cover, right? Because the person who's actually searching that topic most likely is caring for a spouse or a family member who's recently had a stroke. And they don't know what to do, they're kind of in a jam. This is somebody who may need home care. So as you're talking to them about this is how you care for someone who has partial paralysis due to a stroke, you're sitting there saying, I am also the founder of AidBook, a home healthcare agency in Florida. This is what we do. We help out. We sometimes provide caregivers, physical therapy, speech therapy, whatever may be needed for someone like this. The more you kind of put those threads out into the internet universe, the more roads you have leading back to you. So I hope that that kind of gives you some insight as to how I think and how I approach driving traffic from the internet. It's not about your website. It's about what sort of information you're putting out there that will pull people and attract people to you.
Yeah,
Or you pay
fantastic. And
or you pay for traffic.
yeah, and this is just kind of my color commentary here, but a few things I've seen people do is, like, let's say that I name my agency like Angels of Love Home Care. I'm really focusing on my brand name, Angels of Love, and that's not what people are going to be searching for. And then another thing that I've seen people do is that, like I know in New York you have like the certified agencies and the licensed agencies and the TAs and the LICSAs and all that kind of thing. And people, get very hung up on, well, I am providing non-medical home care, so I'm not going to say, like, I'm not going to put content on my site about finding a nurse, right? Because I don't provide nurses, I provide caregivers. But if you think of some of the examples that Karl provided at first, I mean, the person whose mom, kind of fell and broke her hip and she's coming out of the hospital in 2 days, she doesn't know the difference between a nurse and a caregiver. So make sure that you're using, like, those search terms, that, like, I mean, because people might be looking for a visiting nurse, even though they want a non-medical home caregiver. And another important thing is, Karl, I mean, has this business in New York and Florida that he talked about, and also, his brand and a lot of things he does are nationwide, and that's how he gets, followers. But a lot of you are very local, right? So you're going to want to make sure that you have content that covers the names of the specific towns that you are providing services in, and make sure that you're not just like saying, well, come on, I built my page around the keyword, Angels of Love Home Care, and nobody's finding it. And that's because, people aren't specifically searching for Angels of Love. They're searching for, help for my mom after she hurt her hip, I need home nursing in, in Dubuque, Iowa, or whatever the case may be. So that's really.
Nobody cares about your brand, your logo, or any of that until your brand and logo means something. Right? You can have the prettiest logo and the best name, but nobody cares about it unless you have mass effect of people interacting with that. So I agree with you. A lot of people get caught up in that, and that's not what makes a difference. And you did touch on a really good point. Since you are dealing in a local environment, it might be good to create content like how to pick a visiting nurse in whatever your city is, right? Because even if you kind of segment down to a certain city or a certain neighborhood, the search engines know what neighborhood you're in, and they're going to serve you information that resonates with you in some way, right? That even if you're local to Carmel, New York, and somebody has an article about home care in Carmel, New York, what do you think is going to happen? The Google machine is going to match you up with that article or that blog because they know that you live in Carmel, New York, and they know that you've been Googling or searching visiting nurses or home care, or you've been in a hospital for a certain amount of hours every day for the past week. So obviously somebody's been hospitalized because that's not your job. So you have to start thinking like the machines think and start trying to position yourself between how the machines are thinking and kind of consolidating information and making sure that you're showing up in front of them.
Perfect. All right, I'm going to go on to the next one here. I'm reading it off the screen. Okay, it says that, hold on, I'm going to try to paraphrase this a little bit. All right, so it basically says that people might be searching for, like special things to differentiate their agency from anybody else's agency. And, again, I'm trying to paraphrase, but, could you think of certain, special types of skills other than regular home care and maybe memory care that people might be searching for that might be unique and help an agency to differentiate themselves in some searches?
From the public perspective?
Yeah, I think so. I think that they're just trying to say, like, what kind of unique, instead of being just a vanilla agency, like what are some, maybe unique things that if they specialized in a certain type of skill. I guess you gave an example earlier with, you know, you know, after a stroke. So that might be something that would search for. But do you have any other ideas of something special other than, you know, standard home care that people might be
I would target
searching
ethnic.
for?
I would target I would target ethnic groups and subcultures within the U.S.
Hmm.
because there's often times, for instance, one group that I'm looking to target in New York is the Nepalese community. There's enough people from Nepal in New York City to have a community, but there's no one really speaking to them. So if all the advertisements are in English or Spanish or whatever, those are the two most popular languages in the US, why not look at how to niche down to certain ethnic groups, especially if you're in an ethnically diverse city. Big cities tend to be ethnically diverse, so you can kind of concentrate on a certain language, because especially when you're doing personal care, things like customs, religion, food choice, etc. If you have an aide who doesn't understand their food culture or doesn't understand their household culture, it's that relationship is not going to work out. So matching your agency to kind of satisfy a subset of like society or a minority group within the United States, I think that's one way you can differentiate yourself, and it's relatively common and easy to do. That no one is speaking to those smaller communities, so you can start speaking to those smaller communities and build around that, and you become the expert in home health care for that particular community.
Yeah, just, you know, funny anecdote. We have one customer who is like a Nepali agency, and one thing that I've seen, and I actually asked them how this came about, but a lot of their clients' birth dates are January 1st. And so I kind of said, well, why is it that you have so many clients whose birthday is January 1st? And they basically said that, you know, that the concept of like the birthday is just not as big a thing. And then when they come over here and you need a date of birth, they kind of make it up. They know roughly what year they were born, and they kind of make that up. I mean, I'm not sure that would help with marketing, but it is just kind of an interesting, you know, thing that shows how different communities are, you know, viewing themselves. Okay, this next one is, it says, what's the number one thing you know now that you wish you knew then about home care?
The thing that I wish I learned about the roll-up strategy earlier on in my career. Right now, the home health care industry is extremely fragmented. A lot of smaller operators, and in states like New York, they're starting to force consolidation. If I knew that I could buy and consolidate home healthcare agencies earlier in my career, it's something that I would have been doing a lot earlier. And knowing how to do leverage buyouts, understanding how debt instruments work, understanding how just the private equity world works, that's something that I wish I knew earlier, that I learned that through kind of going through the startup world, by trading stocks, by just kind of navigating life and kind of getting little bits of information. We were an acquisition target by one of the publicly traded home care agencies last year. And then another agency that was looking to consolidate and go public also vetted us for a purchase. And I got to see both their perspectives, and both of them were growing through acquisition. The publicly traded company was growing through acquisition. They're trying to buy at 4 and 5 times earning, while they have a earnings multiple of 60. And the other agency was looking to aggregate $250 million. This is exactly what they said. We're buying $250 million of home healthcare agency revenue. We're going to season that purchase for 3 years, and we're going to take it public. That's our entire strategy. And to buy that $250 million worth of rev, you're probably looking at a $50 million cash requirement, which they raised, and that's pretty much what they were doing. So it gave me insight into kind of how to think larger, and I wasn't thinking that way earlier on. So if you're thinking, how do I make mega money in healthcare, it's really through consolidating smaller fragmented operations, and that's what I wish I knew earlier.
Yeah, very interesting. So, we have, I guess one of the things that we found in Ankota is that, a lot of, I guess there's, in our numbers of estimations, there's maybe around 2,000 pretty big home care agencies, and then there's around, 20,000 pretty small home care agencies. And, so we've, so we really try to make ourselves very friendly to the small agencies. And, so we sort of do that and try to make it, real simple and quick onboarding and simple software and all those kinds of things that we provide. But I think that, probably of looking, just I was just kind of glancing through, and I know some of the attendees on today are probably more in the smaller camp than the bigger camp. So you kind of threw out some numbers there, and it sounds like when, like when somebody might be considering buying them, what it looks like is they might be looking at a multiple of revenue, or they might be looking at a multiple of earnings, right? So, and I guess, so if you could just elaborate on that a little bit, so people, like let's say that they've grown their agency and they're like at, $1.5 million of revenue a year, and somebody might be thinking of buying them, like what would that buyer be looking at in terms of their numbers?
Okay, so in home health at that size, there's two schools of thought. There's going to be the earnings multiple, right? And that's going to be on your EBITDA, your earnings before taxes, interest,
debt, yep.
depreciation, and amortization, those, right? So your EBITDA is going to be, let's just say if you're doing $1 million, maybe you're doing $300,000 EBITDA, you might command anywhere from 3 to 5 times your EBITDA. So 3 million, you might be able to sell for anywhere between 900,000 and $1.5 million. Okay, and you might be doing that on $1 million, $1.5 million, depending on your case mix. Is it private? Is it Medicaid, etc. The other multiple that's used is a fraction of your revenue. Some of the companies are just outright purchasing at 50% rev. So if you were doing 1.5, they'll be looking to buy you at 750 because the numbers still kind of match up the same. The smaller your revenue, the smaller your EBITDA is going to be, because you have like seller's discretionary earnings, such as your automobile expenses, how much you're paying yourself as the owner operator, those sort of things. Certain positions cannot be eliminated, while some can. And they're going to usually do a purchase in two forms. Either they're going to do an asset purchase, or they're going to purchase the full operation. Asset purchase is they're just purchasing your patients and some of your staff. And if they're buying your entire agency, they're typically buying, that's going to be a bigger agency because there's going to be better operations in place. There's going to be more market penetration or market authority for those agencies. So they want to kind of keep that brand in place, and then they'll just kind of pull it into the umbrella. But when you're smaller, you're going to get smaller multiples than when you're larger, generally.
Got it. All right, excellent. So I'm actually down to the last question that's in the questions area here. And so if you do have any other questions, we'll probably just take this one, and maybe if there's one more. But this one says, we are a totally Medicaid agency, and sometimes, there's ups and downs with Medicaid. Can you make some suggestions about other sources of revenue, or kind of other income sources that we can consider?
Well, I got some more follow-up questions for them, but so they're mostly Medicaid. Obviously, the next obvious one is private pay. You're probably going to be able to get more out of the private pay clients than you would out of Medicaid. So I would try to attract private pay clients. You could do that with mailers. You could do that with Google ads. You could target certain neighborhoods that have higher net worth people and who can afford it. You could target elder care attorneys who may have worked with setting up long-term care health insurance plans, or financial advisors who kind of sell that service as well, because they're going to have a group of private pay, or people who can pay privately. Someone who's seeking the expertise of an elder care attorney is usually looking to manage your assets a little bit better and kind of offset estate taxes and that sort of thing. or even help them qualify for Medicaid, even though they're way beyond the income requirements. So I would look at first the private pay audience. Outside of that, then I would look at who do I have in my workforce and how else can I monetize them? You can monetize maybe by doing housekeeping services, because some of the aides may be totally comfortable doing housekeeping services as an add-on to the wages. They might only be working 20 hours a week, but you could do 4 house cleanings, whatever you're charging, and it's kind of within their scope of work. Also, as a home healthcare agency, you have to do your background checks. So these are people who are not criminals, who've been vetted. So you now can market them to homeowners and say, hey, we have these highly vetted professional cleaners that you don't have to worry about them stealing because they're fingerprinted, et cetera. So you can kind of start to go into parallel markets in a way, since you already have that group of employees that you could monetize outside of home healthcare.
Yeah. All right, great. So it looks like we haven't had any other questions roll in. So I think that's probably going to be it for our, question and answer part. But let me just, kind of turn it over to you, Karl, for the last word for today. Like any other, sort of thoughts to close out today's, Q&A with things you'd like to share with the folks online, or things that they might be able to find more about you and that kind of thing?
Sure. Well, I got quite a few. So first, more about me. I do videos every week on real estate, home care. I'm doing a series of live videos for the next 30 days, where every evening I go live and I just answer questions of my following base. Some of them are healthcare related, some of them are stock related, some of them are real estate. Whatever I cover on my channel, I'll get questions that pop up. So you can find me at ENTPlife. That's Echo November Tango Papa space life on YouTube. I'm also under the same name on Instagram, but that's a smaller following and it's just pictures, so not much to really capture there. Also, I have a few technical solutions that I build out. I know that you're in the same space, but one of the things that we're working on that's pretty cool is a referral management platform. It's entirely free. You can register for that at goinghome.agency. What I realized in New York, working in New York, it's pretty fragmented. The process of just getting somebody from being Medicaid eligible to enrolled into an MLTC plan, and they're all disconnected. It's awful. You have tons of spreadsheets that you're managing, and tons of communication with different players. So I brought that into one platform. And what we're doing now there is we're bringing providers onto the platform and trying to create a two-sided marketplace, so that the providers who are looking for home care service agencies can make referrals on the system, and then the agencies that have on the other side are able to benefit by getting those open referrals and potentially meeting that demand. So it's preliminarily free. You can use it. You can use it to manage your own referrals. And then as we start to route referrals into different areas, especially for markets that we're not in, it's important for us to have agencies that we can route that referral flow to, so that they can benefit and grow while we either prepare to get into that market or just being able to make that process a little smoother. And last bit of advice that I would give, I think, would be to read the book, The Lean Startup by Eric Ries. It is a book that truly teaches you how to think like an entrepreneur and teaches you how to make your decisions. And they use a method called validated learning. And it's really a play off of lean manufacturing, which is the model that Toyota used to kind of penetrate the market the way that they have. And really what they're saying is that every decision that you make in your business, just like Jeff Bezos said, should be driven by data. And if your company focuses in this way, every employee can come to the table and say, hey, I've made this observation that we're losing cases because of X reason. I've been tracking it for 3 months. It's because our phone system is trash, right? We need to upgrade our phone system. and this is the chief complaint that we're getting, etc. And it teaches you that you can make that argument, how to present the idea, how to capture the data and communicate the data so that it's clear. And the thing that we do as entrepreneurs or people in business is sometimes we're tracking the wrong metrics. So it teaches you the difference between vanity metrics, right, with things that may not matter, like how many likes you have on your Facebook page or something like that. It's like, it doesn't matter if people like you. How many of these likes are converting into clients? How many of these likes are converting into the end result that you really want for your company? So it teaches you the difference between those two. And so if you really want to grow your agency and you really want to compete with the bigger players in your space, you're going to need to think like the bigger players. And that's probably the best book to give you a step-by-step model for you to follow so that you're starting to think in a more business savvy way. So the Lean Startup, totally recommended.
Fantastic.
Actually,
all right, well, I think we'll, go ahead.
I give 3 books to all employees when they're onboarded: Rich Dad, Poor Dad, Lean Startup, and Crucial Conversations. Rich Dad, Poor Dad, so that all my employees can understand how money works in this country in a very simple way. We're in it to make money, completely a capitalist, and I want my employees to make as much money as possible as well. Lean Startup for the reasons I just told you, and Crucial Conversations because there's so much that gets lost, especially when you're having high-stake conversations that shouldn't get lost. So it helps our employees manage how they interact with patients, how they interact with patients' families, and how they interact internally, especially when there's a lot of tension. And in home healthcare, there's going to be. So those are the books that I recommend. And that's one of the things that I do to kind of shape the mindset of all the employees within the organization.
Yeah, fantastic. I mean, it's kind of funny. We bookended today's conversation. I think the first question that came in was about retaining and communicating well with caregivers. And then the last thing that you shared today was, I bet that, not that many home care agencies are starting their relationship with a caregiver by giving them 3 books that can make their life better. So I think that really sends a great message and, really kind of shows who you are and the kind of character that you are. And that's why, part of the reason why you've been so successful. So listen, on behalf of everybody who's been here today, let me thank you so much for joining us, and we'll give you all your afternoon back. And anybody who signed up for this, we'll get you the video recap out, and we'll get you some nuggets over to you, Karl, as well. For everybody who signed up, we'll get you all that contact information. And with that, we'll bid you all a great day, and thanks again.
Thank you.
Thanks for watching this video from Ankota. For further information, scroll down and click on the link in the video description below. Have a great day.